Let us see in this video the top 10 bizarre surgical procedures. So, the number 10, hemispherectomy. Hemispherectomy. Believe it or not, this surgical procedure involves removing or disabling an entire half of the brain. The hemispherectomy has been performed since 1923 when Dr. Walter Dandy first used it. It is revo- reserved for cases of extreme seizures that cannot be controlled through meditation. All of the people who have this treatment end up with paralysis of the body on the opposite side to the brain hemisphere that was removed. In time, most patients regain some of their previous abilities as the other side of the brain takes over from the missing sections. Number 9, hemicoprorectomy, also known as translumbar amputation. This surgery removes the lower half of the body from above the pelvis. The result is that the sexual organs, anus, rectum, legs, pelvis bones, and urinary system are removed. The procedure is only recommended as a last resort for people suffering fatal illness. It has only been performed in a small number of cases and it normally takes place in two stages. The first to disconnect the parts of the body to be amputated, and the second to perform the actual amputation. Number 8, bilateral cingulectomy. This is a brain surgery used in pain treatment for severe cases of cancer. It involves disabling the frontal lobes. So, in a way, it is a less extreme surgery than a lobotomy. It is also sometimes used in surgery for mental disorders, but its use in that area is highly controversial, though is well supported in the case of pain management. Number 7, endoscopic thoracic sympathectomy (ETS) is a surgery in which portions of the sympathetic nerve trunk are dissected. By cutting these nerve sections, the surgeon is able to treat severe cases of hy- hyperhidrosis, excess sweating. What makes is bizarre is a side effect of this treatment is that the person no longer blushes. For that reason, it has also become a cosmetic procedure for people who blush excessively. Number 6, vaginectomy. In a vaginectomy, part or all of the vagina is surgically removed. This is normally used as a treatment for various forms of cancer, but it also occurs in some sexual reassignment surgeries. It is normal for a surgeon to reconstruct the vagina after this surgery by using other parts of the patient's body. Number 5, lobotomy. Lobotomy is a very controversial medical treatment in which the frontal lobes of the brain are destroyed. While it is seldom performed nowadays, it does still occur. Lobotomies have been used in the past to treat all manner of mental illnesses, including schizophrenia. This procedure often results in major personality changes and sometimes mental retardation. John F. Kennedy's sister was given a lobotomy against her will. Number 4. Penectomy. A penectomy is the total removal of all or parts of the penis. It is normally used as a treatment for cancer, but it sometimes had to be performed after a botched circumcision. Horrifying penectomies have been performed occasionally on men who wish to use it as a form of extreme body modification. Many doctors consider this use of the surgery is unethical. Number 3. Circumcision. Circumcision is a very common procedure performed for religious reasons among Jews and Muslims and by many doctors who claim health benefits. Much controversy surrounds this procedure as it is non-essential surgery normally performed on a child that has no say in whether it is performed or not. Number 2. Foreskin restoration. Foreskin restoration is the process of expanding the skin left behind after a circumcision in order to create a new foreskin. The technique is most often requested by men who have suffered in an injury to the area, been circumcised as a child, or who wish to have a larger foreskin. During World War II, some European Jews sought out surgical foreskin restoration treatment in order to avoid Nazi persecution. Number 1. Lindbergh operation. Lindbergh operation is included here as a special mention. It was the first surgery ever performed entirely with robots being guided by doctors through telecommunications. The surgery occurred in France and it was controlled by French doctors in New York. That's all. These are the top 10 bizarre surgical procedures.